A change to the definition of close contact when it comes to COVID-19 coming out of the Centers for Disease Control. And now there's concern it could change the number of people contact tracers need to track down after a positive case is discovered. Western Mass News reporter Audrey Russo joins us live with more on this story. Audrey?
The CDC issuing this change after a COVID-19 case in New England didn't follow their usual guidelines for what it means to be a close contact for an infected person. By now, we know that COVID-19 spreads primarily through droplets shed from the mouth and nose, which is why wearing a face covering is encouraged. But keeping distance is important too. A doctor with Bay State Medical Center says health officials, like those with the Centers for Disease Control, are constantly monitoring how long it takes for the novel virus to make the jump from one person to another, known as a close contact.
If you look at the studies that have come out over the past 2, maybe 3 months, we've shown that, in poorly ventilated areas, the virus can linger a little bit longer.
Here I am in my 6-foot bubble here. The old CDC guidance was that coming within an infected person 6 feet for a period of 15 consecutive minutes or more meant you were a close contact. The CDC changed that after an infection in a Vermont jail happened after a series of shorter, non-consecutive exposures.
This individual did not meet the official, CDC definition for close contact.
Western Mass News spoke with Natalie Quitt, a Vermont state health official who studied this jail infection. Quitt says in August, a correctional officer caught COVID-19 from infected inmates. She says his exposures were 22 brief instances.
Taking out soiled laundry, letting incarcerated persons out of their cells for recreational time.
Adding up to 17 minutes total. Quitt says the officer wore a mask the whole time, but the incarcerated people only covered their faces part of the time. The guards' catching of the virus caused Vermont state health officials to warn the CDC.
We thought other jurisdictions should know, and we should share this with them because it might affect, contact tracing.
Now you can be labeled a close contact if you've spent 15 minutes or more total with an infected person within a 24-hour period. That could be 3 5-minute conversations with an office coworker or a student in school throughout the day. But Dr. Del Pilar says as far as contact tracing goes, they ask a few more questions before totaling up the minutes.
We don't necessarily focus on how much time the patient spent with the positive person, but rather what was the nature of the contact.
Del Pilar says private gatherings and lack of mask wearing are 2 factors that raise concern.
Then you kind of get into how long were they kind of hanging out together.
Still, he hopes the new guidance will encourage people to know the risk every time they come within 6 feet of another person.
I do think it'll make people a little bit more conscientious about the choices that they made.
If you've been identified as a close contact, that's usually a call that comes through a local health department. The CDC recommends quarantining for a period of 14 days. Live in Springfield, Audrey Russo for Western Mass News.